If you're over 60, I want you to pause for a moment and think about this. There are pills many older adults take every day, pills that feel routine, normal, even necessary, that may be quietly putting extra stress on the heart. Not rare drugs, not experimental treatments, but common medications that are approved, prescribed, and trusted. That's what makes this uncomfortable. Heart specialists have been raising concerns lately, not about surgery or rare conditions, but about everyday pills seniors rely on. These are medications most people never question because they've been told they're safe, and in many cases they are, at first. The problem is what happens after 60 when the body changes, but the prescriptions often don't. As we age, the heart, kidneys, and blood pressure system become more sensitive. A pill that once worked smoothly can start having a very different effect. The signs are easy to miss: feeling more tired, getting lightheaded when standing, swelling around the ankles, shortness of breath that gets blamed on age. Most people never connect these changes to medication. They assume it's just part of getting older. That's how this risk stays hidden. This video is not about panic, and it's not about telling you to stop taking anything on your own. It's about awareness. Today we're going to talk through 5 common types of pills that deserve a closer look after 60. So you know what to watch for, what questions to ask, and how to better protect your heart going forward. Let's start with one almost everyone has used at some point: common painkillers. Pill 1. NSAIDs, common painkillers. Now let's talk clearly about pills many seniors are already using, often without a second thought. These are common painkillers like ibuprofen, naproxen, and diclofenac. You may recognize them from prescriptions you've had for years, or you may take them for arthritis, joint pain, back pain, or everyday stiffness that comes with age. They work. That's why people trust them. But after 60, the way these pills affect the body, especially the heart, can quietly change. Here's what matters in simple terms. These painkillers don't just calm pain, they also affect how your kidneys handle salt and water. When that system is altered, the body can start holding on to extra fluid. And when there's extra fluid in the body, the heart has to work harder to move it around. For an older heart, that extra workload can slowly become a problem. This usually doesn't show up as sudden pain or an obvious warning. It shows up quietly. You might notice your ankles or feet swelling by evening. Shoes feel tighter than they used to. Walking leaves you short of breath sooner. You feel more tired doing things that never used to bother you. Most people assume this is just aging, not realizing a pain pill may be adding pressure behind the scenes. There's another issue many seniors are never told about. These painkillers can also raise blood pressure or make blood pressure medicines work less effectively. So even if you're taking pills to control your numbers, regular use of these painkillers can quietly push pressure back up. High blood pressure combined with fluid retention is a tough mix for the heart. The risk increases when these pills are used frequently, not just once in a while. Taking these painkillers occasionally is very different from using them daily or several times a week for ongoing pain. There's also a combination that concerns many health experts. When painkillers are taken along with certain blood pressure medicines or water pills, the kidneys can become stressed. When the kidneys struggle, fluid balance worsens. And once again, the heart ends up paying the price. Now this part is important. This does not mean you should stop these medications on your own. And it does not mean pain should be ignored. Living in constant pain isn't healthy either. What it does mean is this: after 60, regular use of these painkillers deserves a second look. If you're using ibuprofen, naproxen, or diclofenac often, pay attention to changes that seem small: swelling, breathing changes, rising blood pressure, or fatigue that doesn't quite make sense. These aren't just annoyances, they can be signals. This is also the right time to ask better questions. Is daily use necessary? Could the dose be lower? Are there safer long-term options for pain support? Awareness alone can protect the heart more than most people realize. And before we move on to the second pill on the list, take a moment to like this video and subscribe. This channel is designed for seniors to make changes that can lead to a powerful, healthy comeback. Pill 2, anxiety and sleep pills, benzodiazepines. Now let's talk about a pill category many seniors rely on quietly: anxiety and sleep pills. These include medications often used to take the edge off, help with sleep, or calm nerves. Names vary, but the goal is usually the same. Feel calmer, rest better, get through the day without stress. And for many people, these pills do bring short-term relief. But after 60, their effect on the body and the heart can change in ways most people are never warned about. Here's the part that matters. These pills slow the nervous system. That's how they create calm. But the nervous system also controls breathing, balance, heart rhythm, and how quickly the body responds to stress. When it's slowed too much, the entire system becomes less responsive. For older adults, this can show up in subtle ways. Breathing may become shallower during sleep. Oxygen levels can dip without you realizing it. The heart then has to work harder to compensate. Night after night, that added strain can take a toll, especially if there's already a heart or lung issue. Another concern is balance and reaction time. These pills can make the brain respond more slowly. That increases the risk of falls, and falls in older adults often lead to hospital stays, surgeries, and long recovery periods. Each of those events puts serious stress on the heart. There's also the issue of long-term use. Many seniors start these pills for a short period, then stay on them for months or years. Over time, the body becomes used to them. The calming effect weakens, but the side effects remain. People may feel foggy during the day, unsteady on their feet, or unusually tired. Symptoms often blamed on aging. The heart feels those changes too. Slower breathing, poor sleep quality, and repeated nighttime oxygen dips all create extra demand on the heart. It's not dramatic, it's gradual, and that's why it's easy to miss. One more thing needs to be said clearly. Stopping these pills suddenly can be dangerous. The body can react strongly with anxiety spikes, sleep disruption, and even heart rhythm issues. This is not something to quit on your own. The real issue isn't panic, it's review. After 60, it's worth asking whether these pills are still needed, whether the dose still fits, and whether safer options exist. In some cases, simple changes in routine, sleep habits, or timing can reduce the need for them. In other cases, slow, supervised adjustments may be appropriate. None of this means you've done something wrong. It means your body has changed, and your medications may need to change with it. If you're using anxiety or sleep pills regularly and notice daytime fatigue, balance issues, breathing changes at night, or increasing reliance on the medication, those aren't things to ignore. They're signals, and understanding them can help protect not just your sleep or mood, but your heart as well. Next, we'll look at a pill many people think is completely harmless because it helps the stomach. Yet it can quietly affect the heart in a very different way. Pill 3, acid-reducing pills, PPIs. Now let's talk about a pill many seniors take every single day without much concern. Acid-reducing pills. These are often used for heartburn, reflux, or stomach pain. Names may vary, but they're commonly taken to stop acid and bring quick relief. And to be fair, they do that job well. The problem isn't short-term use. The concern is what happens when these pills are taken daily for months or years, which is very common after 60. Here's what most people are never told. Stomach acid isn't just there to cause discomfort. It plays an important role in helping the body absorb key nutrients. When acid is blocked for a long time, absorption of things like magnesium, calcium, and vitamin B12 can slowly drop. That matters for the heart. Magnesium helps keep heart rhythm steady. When levels fall too low, the heart can become more sensitive and irregular. Calcium balance affects how the heart contracts. Vitamin B12 supports nerves and blood health. When these levels slip, the effects are subtle at first, but they add up. Many seniors on long-term acid pills notice symptoms they don't connect to medication. More fatigue than usual. Muscle weakness. Heart flutters or an uneasy chest feeling. Lightheadedness. These are often blamed on age or stress. Rarely does anyone think to look at a stomach pill. There's also another issue. Long-term acid suppression can change how bacteria grow in the gut. This can lead to more inflammation in the body. Inflammation puts extra strain on blood vessels and the heart over time. Again, not suddenly, quietly. What makes this tricky is that these pills are often started with the idea they'll be temporary, But many people stay on them because symptoms return when they stop. So the pill continues year after year without review. To be clear, this does not mean acid-reducing pills are bad or should never be used. They can be very helpful, but they were never designed to be lifelong medications for everyone. After 60, long-term use deserves a closer look. This isn't about fear, it's about balance. Another important point, stopping these pills suddenly can cause rebound acid symptoms, which feel worse than before. That's why any change should be slow and planned, not rushed. If you've been taking acid-reducing pills for a long time and notice fatigue, muscle cramps, heart rhythm changes, or just a general decline that doesn't make sense, it's worth paying attention. These pills help the stomach feel better, but over time, they can quietly affect the systems the heart depends on. And next, we'll talk about pills that are meant to protect the heart and blood pressure, yet can still become a problem when the body changes with age. Pill 4, blood pressure and heart medications. Now let's talk about pills that are meant to protect the heart. Blood pressure and heart medications help millions of people live longer, healthier lives. For many seniors, they are essential. That needs to be said clearly. But here's the part that doesn't get enough attention. As the body changes with age, the same dose that once worked well can sometimes become too strong. Not because the medicine is wrong, but because the body it's acting on is different now. After 60, blood vessels become more sensitive. Kidneys handle fluid differently. Nerves that control blood pressure don't respond as quickly. That means blood pressure can drop faster, especially when standing up or changing position. This is how it often shows up. You stand up and feel lightheaded. You feel weak in the morning for no clear reason. Walking feels tiring even on short distances. Your heart rate feels unusually slow, or you feel off without being sick. By this point, many people stop questioning these changes. They adjust their routine instead of asking why it's happening. Another factor is medication combinations. Many seniors take more than one heart or blood pressure pill. One lowers fluid, another slows the heart, another relaxes blood vessels. Each may be appropriate on its own, but together they can sometimes push blood pressure lower than the body can comfortably handle. There's also an issue that's often missed completely: nighttime blood pressure. Many people take blood pressure pills in the evening. In some older adults, this can cause blood pressure to drop too low during sleep. When that happens, blood flow to the brain and heart can be reduced overnight. The signs often appear in the morning: feeling dizzy when getting out of bed, weakness that fades later in the day, unsteadiness during the first steps of the morning. These aren't random. They can be signals that nighttime pressure is dipping too far. This matters because the heart relies on steady blood flow, day and night. Large drops, even during sleep, can strain the system and increase the risk of problems when standing or moving suddenly. We've already talked about falls earlier in this video, so I'll keep this short here. Anything that increases dizziness or instability raises the chance of falls. And falls are especially hard on older hearts. Now, an important reminder: this does not mean you should stop heart or blood pressure medication. Stopping suddenly can be dangerous. That's not the goal. The goal is review. After 60, these medications should be checked regularly. Not just the numbers on a chart, but how you actually feel. Morning symptoms, energy levels, balance, daily function. If you're taking blood pressure or heart pills and notice dizziness, weakness, slow heart rate, or feeling drained in a way that doesn't make sense, those are worth paying attention to. They aren't complaints, they're information. Because even the right medication can become a problem when it no longer matches the body taking it. And that brings us to the final pill on this list, the one that ties all of this together and affects more older adults than any single medication ever could. Pill 5, polypharmacy, when the combination becomes the real risk. Now we come to the most important pill on this list, and it isn't a single pill at all. It's polypharmacy. That word simply means taking multiple medications at the same time. For many adults over 60, that number is 5, 6, sometimes even more, taken every single day. And this is where the real danger often lives. Each pill may have been prescribed for a good reason. One for pain, one for sleep, one for blood pressure, one for the stomach, maybe another for cholesterol. On their own, each one can make sense. The problem is what happens when they're combined. Inside an aging body, medications don't work in isolation. They interact. One pill may slow the heart, another lowers blood pressure, another changes fluid levels, another affects the nervous system. Together, they can push the body further than any single pill ever would. For the heart, this can be especially stressful. Blood pressure may swing too low at certain times of day. Heart rate may slow more than intended. Fluid balance can shift back and forth. Oxygen levels during sleep can drop. None of this happens in a dramatic way, but the heart feels the strain. This is why polypharmacy often shows up as confusing, scattered symptoms. You feel tired but not sick. You feel dizzy sometimes but not always. You feel foggy in the morning, better in the afternoon. You feel weaker than before, but tests look okay. So people bounce between appointments. One pill gets added to fix a side effect from another. The list grows. And no one steps back to look at the full picture. That's the danger. Older bodies don't process medications the same way they used to. The liver breaks things down more slowly. The kidneys clear drugs less efficiently. The nervous system becomes more sensitive. What once worked smoothly can start overlapping in ways that stress the heart and brain. Polypharmacy also makes it harder to spot warning signs. When symptoms come from one pill, they're easier to identify. When they come from 5 interacting drugs, everything gets blurred. People adapt instead of questioning. They change how they move, how much they rest, how much they go out. Without realizing medication load may be part of the reason. This does not mean medications are bad, and it does not mean fewer is always better. What it means is this: after 60, the combination matters just as much as the prescription. That's why many heart specialists now emphasize regular medication reviews. Not rushed, not once every few years, but thoughtfully. Looking at what's still needed, what overlaps, what could be adjusted, and what might no longer fit the body you have now. If you're taking several daily medications and notice fatigue, dizziness, balance changes, mental fog, or a general sense that your body isn't responding the way it used to, that's not something to brush off. Those are signals. And often the most powerful heart protection doesn't come from adding another pill, but from understanding how the current ones work together. If there's one thing I want you to take away from this video, it's this: awareness matters. After 60, heart safety isn't just about adding the right pill. It's about making sure the pills you already take still fit your body. Medications don't stay neutral forever. As the body changes, their effects can change too. The most powerful step is not stopping anything suddenly. It's reviewing, looking at the full list, noticing patterns, paying attention to how you feel in the morning, during walks, or at night. These details matter more than most people realize. Many seniors regain energy, steadiness, and confidence simply by adjusting doses, timing, or combinations, not by adding more medication. Now, we'd love to hear from you, and I personally read every comment. Which of these pills made you stop and think? Or which of these surprised you the most? Share below. We're building a community here for strong comebacks. So subscribe, hit the bell icon, and trust me, you don't want to miss what's coming next. If this was helpful, share it with someone you love. Join me in the next video. I've got more surprises waiting for you.